Causes and symptoms of high and low blood pressure. Hypotension and hypotension are two conditions related to blood pressure in the arteries, and it is very important to be mindful of their symptoms. To determine if you have high or low blood pressure and how to treat it, we will explain the causes and symptoms in this article. Causes of hypotension. Low blood pressure can be hereditary and is more common than high blood pressure, especially among thin or young women. If your mother has suffered from it, it is likely that you will as well. Since it doesn't always produce well-known symptoms, people don't tend to treat it. The conditions that can lead to low blood pressure are hypothyroidism, Addison's disease, hypopituitarism, cardiac insufficiencies, pericarditis, cardiac diseases and other cardiovascular diseases, several days of rest, or liquid or salt deficiency. Some medications can also cause hypotension. Some of these include psychotropics for insomnia or depression, cardiac arrhythmias, antihypertensives for high blood pressure, diuretics, coronary medications for angina pectoris for example, and vasodilators. Causes of hypertension. High blood pressure can develop at any point in your life, regardless of sex. It basically increases the blood pumped from the heart and a contraction of the blood veins. It is considered a cardiovascular disease and can come from heart attacks. The problem remains that 95% of hypertension cases don't have naturally manifested causes. A person can suffer from high blood pressure as a result of being obese or overweight, lack of physical activity or sedentarism, excessive salt, fat, or alcohol consumption, stress, and smoking. Chronic high blood pressure affects vital organs, like the brain, heart, kidneys, and eyes, which can cause anything from cardiac insufficiency to vision loss, which can become myocardial or ictus attacks. Hypotension can be hereditary, and men are more inclined to suffer from it, especially when over the age of 40. Overweight and cholesterol levels are direct causes of the disease. Symptoms of hypotension. In cases of low blood pressure, you can suffer from one or several symptoms such as exhaustion, greater need to sleep longer, diminishing of physical shape, concentration problems, depressive emotional responses, apathy, sleep disorders, insomnia, lack of energy, asthenia, lightheaded feeling, lack of strength, a need for hours to fully wake up in the mornings, quickly becoming exhausted, becoming cold easier, especially in the hands and feet, paleness, especially on the face. The circulatory symptoms of low blood pressure arise when there is a lack of blood to the brain. This can occur for example on days when there is a high temperature or when you are in the sun at noon. Fatigue and asthenia are very common and can arise after eating, when blood accumulates in the stomach region. Dizziness is another common symptom of hypotension. Also severe headache, fainting, loss of consciousness, blurry vision, and vision disorders. This is a clear sign that something is not right. the heart can begin to beat faster, tachycardias, the blood veins contract, which is why you may seem pale and the hands and feet seem cold, cold sweats occur, and even fainting spells, because the brain doesn't get enough oxygen and doesn't have muscle control. Symptoms of hypertension. High blood pressure also has its symptoms, and it is necessary to pay attention to the warning signs your body shares. However, the first signs of hypertension aren't noticeable to people, aren't very specific, and develop gradually. Some symptoms are often difficulty sleeping at night, light irritability, insomnia, restless sleep, recurring nightmares, waking up several times, auditory problems like cacophony, buzzing or sounds in the ear, etc. Intense headaches or dizziness can indicate a case of hypertension, especially when you are dealing with a lot of stress, nerves, or anxiety. Women who are 50 and older show symptoms of high blood pressure that may resemble menopause, mood swings, breathing problems, headaches, dizziness, which is why many don't receive the appropriate treatment. Middle-aged men can also experience symptoms associated with erectile dysfunction. In some cases, chest pain, dyspnea, tightness in the chest, or a suffocating feeling requires medical attention, since high blood pressure can be associated with heart problems. Arrhythmia can also cause hypertension.